This video will demonstrate the removal of a nasogastric tube. Prior to the procedure, follow these 4 steps. Pull the curtain for the patient's privacy. Place a towel or disposable pad across the patient's chest. Give tissues in an emesis basin to the patient. Clamp the NG tube. Discontinue the suction or feeding from the tube. Next, you want to verify placement.
From here, you should see gastric content returning into the NG tube. We want to replace gastric content, and we have now verified placement.
Now we are going to flush the NG tube with 20 milliliters of water or normal saline.
We are flushing the NG tube here to ensure that there's no leftover particles that could possibly cause the patient to aspirate when removing.
Once that is complete, then we're going to flush the NG tube with 20 milliliters of air. You're going to reclamp that, and then you're going to unfasten the tube from the patient's gown and carefully remove the adhesive tape from the patient's nose.
I want to hold on to the NG tube here to not accidentally dislodge it.
Once the tape is removed, instruct the patient to take a deep breath and hold it. And while the patient is doing that, you want to quickly but carefully remove the tube while the patient holds their breath. As you are removing the tube, you would want to coil the tube in the glove as you're removing it from the patient. And then dispose of the tube and the glove in the trash can. You'll want to perform hand hygiene, lower the bed, and following the procedure, follow these steps, and that concludes removing a nasogastric tube.